Hi everyone, I have quite a fun video today. I'm going to be talking about how I help people with low back problems and even very, very severe low back problems. And these are really interesting cases because a lot of times when someone has a really bad back pain, you can't even touch them. So if they have like a ruptured disc, herniation, or a bulging disc, these things can be very, very painful. And so any sort of movement in the back can actually be quite aggravating. So there's a really, really great way to treat this that's very, very effective. And so I'm going to tell you what that is. I'll tell you very, very, very shortly. And I'm also going to explain why that's the case, because it might not be a good enough answer for you. Basically, when people come in with these sort of back issues, what we do is we fix their neck, okay? And when we fix their neck, fixing their neck actually helps to activate the part of their brain that switches on the muscles that give the joints stability. So fixing the neck activates part of the brain that turns on the spinal stabilizers, if we do it properly. And then the spinal stabilizers will actually help to work to hold the joints together, and then they'll heal. So I'm going to explain in a little bit more depth and give a little visual here. So this is what the spine looks like. This is a lumbar spine. Here's your sacrum. These are your lumbar vertebrae. And every time we move, whenever we move away from a neutral position, there are muscles that have to contract at the same time that we're moving to help hold the joints together. So those are what we call intrinsic muscles. In other words, if we didn't have these muscles, what would happen is we tried to move and the bones would just fall off each other. So there have to be muscles that give a little bit of resistance, not to stop it from moving, but actually just to hold it together. It's sort of like, when you're lowering a rope, you can't just let the whole thing go. You have to actually lower it carefully. So when you're lowering things, you have muscles that are contracting and lengthening at the same time. So that's the way these intrinsic muscles work. Your extrinsic muscles move you away from neutral, and so they're getting shorter as you go away from neutral. And the intrinsic muscles are contracting but getting longer when you're moving away from neutral. So they're both contracting. One's contracting and getting shorter, the extrinsics, and one's contracting and getting longer, the intrinsics. So that's really a key component, because these intrinsic muscles are going to help to hold the joints together. So if something happens that affects the strength of these intrinsic muscles, then what will happen is you'll try to bend and there's nothing actually stabilizing the spine. So those are the people that they bend over to pick up something simple. They don't have that stability, and then they hear click or pop in their back, or they have this amazing sort of tension that just sort of arrives like a bolt of lightning in their back, and everything just seizes up. That sort of a case, that sort of a presentation, there's going to be some sort of instability, whether there was some instability before or in that moment. That definitely means that these muscles that are holding the joints together are not doing a good enough job. So if we can do something to help switch those muscles back on, then your back is going to do a lot better. So let me just go back to that for a second, because when these muscles aren't working, your body senses it and it doesn't like it. And like I just said in that example, when your body senses this and it's putting stress on some of these joints or the disc, what it's going to do is it's going to reflexively contract, or what we call recruit, other muscles as a compensation to try to limit that motion. So in other words, if your erector spinae and this side get tight, that's going to limit you from bending that way. So in other words, if your erector spinae on the right get tight, it's going to limit you bending forward and to the left, and that might be the weak position. So a lot of what people are trying to do when they're fixing low backs is saying, oh, well, this obviously it's this erector spinae tension that's giving you all this trouble. We need to try to get that erector spinae to relax, or we need to try to, get you to practice flexibility because you need to be flexible. Well, that's not really going to fix it. If you try to get a massage or something and make that muscle relax, you'll feel better for a little while, but as soon as you start to move, your body's going to sense that you're unstable still, and then it's going to tighten back up. That's why the next day it's tight again. Or you get some sort of treatment. If it's tight again the next day, then they didn't really fix it. So the only way you can really fix it is by getting those muscles to switch on. So now you're saying, great, show me the exercise. Well, there isn't really a specific exercise to activate those intrinsic muscles. Yes, you can to some extent, but it's not ever very long lasting, and there's usually something else behind that. So what we have to do is look at what it is that turns these muscles on. These aren't really under conscious control. There's certain things you can do that kind of make them a little bit more active, but usually what happens is there's like an area of the spine, or sometimes even a whole section of the spine, which is very, very weak. So it's really, really hard to just do an exercise to get those to switch on and stay switched on. And the reason I say that is because most of the time when we see this, there's also an underlying condition, which is that the part of the brain that switches on these muscles isn't really as active as what it should be. So it's sort of like if there's a certain voltage in that system, there should be 220 volts, and there's 110 volts. And you know, for this circuit, that's a problem. It just means that the lights aren't bright enough, and your brain doesn't have enough power to switch those muscles on. So how do we get more power into that system? Well, that system is driven by sensors in the joints, and primarily sensors in the neck. So the sensors in the neck have a big input into this area. It's an area in the brainstem we call the vestibular nuclei. And the vestibular nuclei is like a big kind of integration center for helping our brain figure out where we are and which way we're moving. So a lot of this information from our inner ear, from our vision, and from these sensors, particularly in our neck, is the highest concentration are in our neck, are all giving information into that part of our brain, and all giving voltage into that brain. So into that part of the brain. So the one of those systems that fails most frequently is the joints. Usually your inner ear is giving good information, your vision is giving pretty good information, and if your neck has something that's wrong with it, maybe you've had a trauma in your neck as well, then what's going to happen is those joints aren't going to move as well. So they're going to give kind of the wrong information, if you will. So if the joints are kind of a little bit out of place, if you want to say that, or subluxated, then what that means is they're not, the quality of that movement isn't the way that it should be, and it's going to give kind of a mixed signal to your brain about where you are. So if we can resolve that, your brain gets a clearer idea of where you are, so the quality of that data changes, but also the amount of voltage, if you will. You kind of have to look at the joints like not only the movement not only gives a sense of where the joint is, but it also gives like a voltage and electricity. So if you think of the joint like a power generator, like a power station, when those joints are moving well, they're generating a lot more power and really driving that system. So if we have joints that are stuck, not only giving confused signals to our brain about where we are, which can kind of affect our ability to know where we are, whether it's conscious or subconsciously, but also it's going to affect that overall voltage of that system. So when we can resolve these things effectively, then when you fix the joints in the neck, you're getting much more voltage into that system. And the output of that system, so in other words, what that system is doing is from the vestibular nuclei, basically part of your brainstem, what it's going to be doing is having an output to the muscles of our spine. It's called the vestibulospinal pathway. And those pathways activate these muscles that create control of function and stabilization in our spine. So if we can boost that system, or if that system is not where it should be, the power stations aren't giving as much power as they should, if we can switch on those power stations, then we're going to switch on that stabilizing system. So when these muscles then switch on in our lumbar spine, those compensating muscles don't need to be tight anymore. So they just melt. They literally melt. Immediately within seconds, the muscles are relaxed. And then people can get up. They have stability in their spine immediately. They can bend, they can flex. And over the course of a couple of days, any kind of tissue changes that have happened can usually work out over the course of a few days or even a week or two. But the stability will be there and stay there, so they'll have a stable spine immediately. And the cool thing about it is you don't actually have to touch their low back. So that was the fun part of it, is that people come in agony in their low back. We can treat their neck if they have the stability issue, which is very, very common. And if we can fix that neck very precisely, I use a technique that I've created called adjusting to neutral, where we take the joint from wherever it is and we release the stresses or the tensions that are keeping it from getting back to the neck's own stable position or its neutral position. If we can resolve that very effectively, then we can balance out the stabilizing muscles in the neck and also the muscles that help move the neck, so that the neck itself has been stabilized directly, but also indirectly by activating that vestibulospinal pathway. So I hope that's not too much garble, but really what it means is that if you have a low back problem, you probably have a stability problem, and the most effective way of resolving a stability problem is by very directly and precisely resolving the neck problems. So when you resolve these neck problems, you should see, if you've done it well, that the stability tests that we use in the spine are all, instead of showing an instability, will show an immediate stability in the spine. So that's great, because we know that as soon as we treat someone, we do these tests, we know the spine's stable before we try to stand them up. And usually these people, even with really, really severe back pains, will be immediately in less pain and have better stability. So once your joints are stable, they can heal properly as well. So you don't have to go on a long, long journey or a battle with trying to stretch it out or trying to do back exercises when your back is painful. You can skip and bypass all that stuff by resolving the neck problem, getting this stabilizing system switched on, which is an immediate thing and usually very, very long lasting. So it doesn't take a lot of work. It seems like a major shortcut. It looks like magic sometimes. It always astounds patients. It's no surprise to me because I've seen it thousands of times, but it's a lot of fun. And I wish more people were practicing this way. But anyway, I'm a chiropractic neurologist or functional neurologist, and there's a lot of other people doing the same discipline, and we all have the capacity to do this. So if any of you have more questions, just fire them into the comments. I'll be glad to answer them. Yeah, just let me know what you think, and I'll be glad to talk about whatever you're interested in. Thanks for watching. Bye now.